Good evening and welcome to Three Beards and a Boss. I am TJ. We have Becky and we have Brian and we have this beautiful woman, Kim. We have been off for about 2 weeks, so we're going to do a little bit of bullshitting for a little bit and then we're going to get right into the topic. So, for the last 2 weeks, I know for me, just getting ready to be in Tennessee, where we're at right now. We are in Gatlinburg, Tennessee, where today I went to Dollywood and I didn't meet my future employer, so I was a little upset about that. But we were looking. Trust me, we were looking.
Yeah.
Every little theater that was there, in the back of my mind, I was going, maybe Dolly's going to be in this one. And the crazy thing is, little Brian he told me today. He goes, "Well, this would be more fun if I knew who Dolly Parton was." So
I failed my child.
So, parents out there, let's
Yes.
try to remind our
Educate.
parent or remind our kids who these icons are and what they meant to us. And because, of course, the new icons of the world are really twisted, and it's really nice to give them a little bit of our childhood and our young adulthood. And what boy did not have a crush on Dolly Parton? So
Every boy.
exactly. So that's what's been going on with us. What's been going on with you, Beck?
Nothing.
Nothing.
Nothing. Just work. That's about it.
Just work, huh? Well,
Yeah.
Brian, we know you've been busy. Every time we turn around, you're constantly working your tail off. So, what have you done fun lately?
Fun? Well, the wife's birthday was this past weekend, so had Friday off and then the weekend off. So got to, go take her around and take her to her favorite spots for like cocktails and for her brunch and for dinners and things like that. So that was fun. Took her shopping.
Destiny's birthday is on April Fool's Day. Do you pull an April Fool's on her?
No.
No, God
Nothing
don't
like
do
that. We had a work outing on her birthday, which we went to Ana Nuevo State Park where the elephant seals breed. And so we did like a 3-hour hike there. So got to see that.
That's so
And
sweet.
went out to dinner. Basically just been dodging raindrops. This is the first week where we haven't had rain. Significant amounts of rain.
Yeah.
And really cold weather. So it's like just kind of recovering and glad there's some sunshine out there. But yeah, just trying to keep the wife happy.
That's not hard.
It's not hard.
That's not hard at all.
Not hard.
Bobby will be on in just a few minutes. Everyone knows that we do this through what's called StreamYard. We kind of all have different lives. We're all in different places. Like me and Kim are in Tennessee this week on our vacation. Becky and Bobby are in Ohio, and Brian is in California. So we're all in different places, different time zones. And Bobby right now is picking his son up from driving school or whatever you call it these days. But little guy's about to start driving, which is kind of scary. So
We're about to have that happen.
yeah.
Yeah.
Maybe.
Nephew and my
Maybe.
son had to drive. Almost died multiple times. Like I couldn't believe it.
Yeah.
And I was like, wow, this is crazy.
Austin
Turning into
got
oncoming
the
traffic thinking it was turn lanes and things like that. And I'm like, oh, there's people coming right at us, you guys.
Yeah.
So I misunderstood Austin one time when I was teaching him how to drive. And since my insurance has already taken care of this, I can talk about this now. So we're coming up to a red light. He wants to turn right. He says to me, he goes, "Hey, can I turn on red?" And in my mind, I'm looking at the signs and you're okay. Yes, right?
Yeah.
So thinking that he would say, okay, well, I have to stop at the red light, make sure there's no cars coming, and then I can turn. No. In Austin's mind, it was he can just turn. Well, he makes a right turn. Another car is coming around the left. We see him. We almost missed him. Our tire rubs on this man's bumper.
Oh.
And of course, it felt like a bumper car. It really, truly did. I was like, did we even hit each other? So I made Austin get in a safe location. The guy just stopped right there. And of course, I think the guy called the police right away because he probably thought we were running. But I was like, we're not going to stop on this corner or start. So I mean, pulled out over, and everything was safe. And then I went up to him, and of course, we exchanged information. Police officer came out. He goes, "Well, there's really no damage. It was just a rub. He had a rub." Now, this guy even put an insurance claim in for a rub on his.
Mhm.
On the side of
That's
his car.
dumb.
But when you're talking to your kids and you're driving, if you ever have that come up, say, stop at the red lights, make sure there's no one coming, and then make the turn. Because I learned the hard way. And then Austin blamed me.
Well, no, listen. When I was in driving school, it was the last year they did it in high school. After that, you had to go to independent driving schools.
Right.
But I'm in driving school. We're on the road. I'm driving. You got 3 kids in the back. You got your instructor in the passenger seat. So my instructor says, go straight through the stop sign and keep going. And I'm like, oh, okay, cool. Well, it's a 4-way stop sign. And there's a car that is coming so I can't do this on screen, but so it's across from me at the stop sign, and it's going to turn left. But he's like, go straight to the stop sign, and that's how we go. And I'm like, okay. Straight to the stop sign to me meant I didn't stop.
Right.
And the guys it was an old man and an old woman in a car that was going to turn left, and they're like waving like crazy. And I'm like, hey, but he's like, what are you doing? I'm like, you said drive straight through the stop sign. So same thing. It's very literal.
Mhm.
When you're in that driver's seat and you're learning, it's literal. And when they said go straight through the stop sign, I didn't think they meant stop and then go straight. I thought they meant go straight through the stop sign. I didn't have to stop at it. So you got to be careful. They're very literal.
It's scary.
You thought those signs were optional, Becky?
I did. He told me to go straight through it. So
Everyone thinks it's a suggestion.
Mhm.
Yeah. Those are
The yellow light is a suggestion that you should slow down.
Well, now that we have cameras on all these yellow lights, it's more than a suggestion nowadays.
Yes.
Yeah, you get a ticket.
And when that first started, you had to have the basically the keeper of the camera, the person that was going to validate the camera footage and everything else. And those were really hard cases to prove.
Mhm.
Yeah.
And now they got that thing down to a science.
Yeah.
If you get a picture in the mail with your tags and it says you ran this red light, you ran the stop sign, you might as well just pay the fine because they got that airtight now.
Mhm.
Yeah.
But when
They
that first
outlawed it.
started, they
Yeah.
didn't. The law was trying to catch up with the technology.
Mhm.
So now they have all that figured out, and people are getting tickets left and right.
Yep.
So
They tried to outlaw it for a while, but then they figured out, no, this is accurate.
So you can't make California stops like Brian makes in California.
With his electric bike.
Yeah, with his electric bike.
Yep.
And we still have not got any footage. He was supposed to make this really high-tech
Mhm.
video, him and on his e-bike, and he hasn't done it for me yet. I'm very disappointed.
Because it started raining right when we did that. I haven't been on my bike
Really?
really since then.
Oh,
Yeah, it's
no.
rained basically for 3 months. Yeah, so I'm
Yeah.
itching to get back on that bike. And this weekend it's going to be in the 70s here, so I think I'm going to get on it this weekend.
Months.
It's going to be in the 70s here, but raining, thunderstorms.
Oh boy. All right.
We've
So
had high winds like crazy too.
yeah, look, we had high winds coming in Tennessee.
Mm,
That's what my mom
And-
said. She
Yeah.
said they've been really bad. And
it was really bad.
We had a power line go down on the pass, and all the cars are stopping, of course. And we get up and we can see
There's
the smoke. Yeah, we can see the
oh
smoke,
my goodness.
and we couldn't go past them, so we had to go around. Well, of course, the GPS
GPS.
doesn't work in the mountains because
No.
you're stuck, right? So Kim got to see me a little frustrated. Not too bad.
My coworker lives. Her sister lives in Virginia. I'm sorry.
Yeah.
Sorry, I was thinking of you guys. Lives in Georgia, and
Right.
a couple days ago, her house got hit by a lightning strike, and it burned to the ground within
Oh
minutes.
God.
Oh wow.
I was just like, I
Mm.
thought we were past the point of getting struck by lightning and having it burn down. But
Yeah.
no, they like have video of it. It's like so sad. It literally burned to the ground in minutes
That's crazy.
from a lightning strike from all
Yes.
these storms.
Ugh. Yeah, I mean, our trip is when it started out a little rough because we had a real bad accident in Virginia before we even get to Tennessee. Then we get this fire on the pass.
Ugh.
So when we finally got here,
Yeah.
we went to the bar at the resort,
Yeah.
and it was like $60 for four drinks.
Yeah.
They were good though.
They were
I
good.
bet. Did you
I
feel
made
it?
a friend.
Yes.
Aww.
Yep.
I
Yes.
made a friend.
He makes instant friends. He's like
Yeah.
so easy to talk to.
Yeah.
So, yes,
Yeah.
I made a friend.
I went up to the bar to get us drinks, and within 5 minutes, I look over and he's just chit chatting with some gentleman.
It was great. So
Love
while we're in Tennessee, we have to try the local liquor.
Yeah.
So first one, go ahead and show up.
So tonight I'm drinking. It's Sugarland Shine.
Yum.
It is Appalachian apple pie,
Woo.
and I put it in some apple juice, and you can't even taste the alcohol. It's so good.
I love
And then
it.
he
I love
is drinking
Oh, Dickel. Yep.
Yeah.
That's
Have you had it?
Tennessee
A
whiskey.
little bit of dickle. Little dickle
Bit
here
of
and
dickle.
there.
Yeah. It's really good. It's on the sweet side.
Oh, okay.
It's on the sweet side.
Does that have like
looks
maple
pretty good.
syrup in it?
It's a nice little whiskey from Tennessee. So I gave her a little bit. When you first get a whiskey, you put a little bit in there, you swish it around, you sip on it, right? And she did a sip of it last night. Her head went back, and
It's not.
it was terrible. I was like, "Oh, baby, you all right?" So it was something.
I also had some Old Smoky strawberries and cream.
Is
and
that good?
was so
good.
Is it
Yeah.
good? They have it up here, but I haven't tried the strawberries and cream.
You
Oh my
have to try
gosh.
it's
How
like,
did you do it? Did you drink it straight or put it in?
I
something?
drank it straight.
Did you?
I did.
it was
But if
great.
it's good that way, then what's
Yeah.
wrong with
It's
that?
some strawberries
It
and
would
cream. That's amazing.
Awesome in some strawberry milk or even
Ooh.
some milk.
Yeah,
Oh my goodness.
it was awesome.
It was so
It-
good.
And we, of course, last night we went and drank, and I had a cigar, and we were on a mountaintop.
Oh.
So we're looking over the mountaintop into the
gorgeous
valley
view.
of Gatlinburg
Hmm
with all the lights. It was absolutely beautiful. And there's a lot of people at the fire pit.
hmm
And so we decided to go sit on the swing first and just look at the view.
Mhm.
And these
Yeah.
two little girls come up and they're like, "Can we have the swings?" And we had to tell these
Aw.
little girls,
We had
kick
to
rocks
sit
with
down.
flip flops.
You can't
So-
tell no to little
Yes, we did
girls.
tell them no. We're like, "Oh, well,
Give us a
we'll give
few."
this up in a few, right?" And I wanted to say, "Well, tell your family to get lost, and
Mhm.
then we
We
can
can have
go
the
sit over
fire
there
pit.
by the fire pit." But
Mhm.
I didn't. I
No.
just let it be with Jesus, and I didn't
Thank
with
you.
the little girls.
It was
It's
such
the
a
Holy
gorgeous
season.
view either way.
I
It was
bet.
so nice.
I bet.
But we are enjoying the Tennessee environment. People here are very friendly.
Mhm.
Even with all the crowds and everything, everyone's pretty nice. Love their accents. Love it. I can't wait. We have 2 more years and we'll be living here, so we're really trying to get to know. And I might even have to change my college football team.
Really?
Because Tennessee is an SEC team.
Mhm.
Well, I'm afraid for my safety if I walk into the state of Tennessee with Florida Gator stuff.
Yeah. We need some
So
balls.
I might have to change my team because I'm not trying to die.
Yeah, no, that's not no. Yeah, just change it.
It's like going into Ohio and like having Michigan crack
Yeah,
one.
yeah.
You can't do it.
People do it. People are
Yeah,
brave
people
to
do
do
it.
it, but it doesn't always end well.
No, people take their football seriously.
They do.
In Virginia, I've gotten away with it because Virginia is pretty much all ACC teams. So no one cares about the Florida Gators in Virginia.
Yeah.
But here in Tennessee, they'll be ready to beat our ass. So we're going to get into why we have Kim on the show. So Kim, go ahead and tell us what you do for a living.
So I am an endoscopy nurse. So I do sedated procedures, colonoscopies, EGDs, ERCPs. And it's a little close to my heart that last month was Colon Cancer Awareness Month, which is the month of March. So we kind of did a lot of extra special stuff for our patients. We gave out blue ribbons. We had a GI Nurses and Associates week where we got some extra treats from some of our physicians, some of our vendors. It was just a really cool way to give back to our population that we see. I not only do outpatients, we do inpatients too that come into the hospital for emergent events. So we kind of have a diverse population that comes to our department.
What is
So
the
with
population?
with colon cancer,
Sorry.
what is the age that you should get screened for
Okay.
colon cancer?
So screening starts generally at the age of 45,
Oops.
unless you have a family history. And it usually goes back 5 years from the initial incidence for a family member. So if a family member has been diagnosed with colon cancer at the age of 45, then you would want to start sooner than that, because it generally takes between 5 and 10 years for a polyp to grow into a cancer. So you want to start your screening before their age that they would have been diagnosed. But generally starts at the age of 45, and that's nationally. And that's either by stool test or by a colonoscopy. And then you come see me and I'll get you to sleep and we'll get your procedure done. And there's also stool tests. I'm on the fence on how I feel about those. I would rather get the direct visualization, get the treatment immediately if it's necessary, because you can get false negatives, false positives with those stool tests. So I'd rather have the direct visualization and get it taken care of immediately. And then it's regular. If there's a boring colonoscopy with no findings, it's every 10 years after that until you turn 75. And you can go to 85 depending on overall health and a good conversation with your physician. And it's at least a minimum of every 5 years if you have a positive finding. So like polyps, or if you have a family history of colon cancer.
So if you have polyps,
Yes.
but they're benign,
Mhm.
you would still probably have to go see them a lot sooner than you would if you were just nice and clean.
Yeah, generally every 5 years.
Okay. Is that because I think we were talking about it? It's
Mhm.
like it takes 5 years to
Mhm.
start. So
5
if
to
you
10
had
years.
one of those, you're going to get them again.
Mhm.
Is that a fair assessment for
Fair
it?
assessment.
Okay.
It's kind of like, so you go to a dermatologist to have your skin looked at, and you have a mole on your skin. Could be a nothing mole on your skin. Could be something that turns into a skin cancer. So you go to your dermatologist routinely to make sure that everything's good.
Mhm.
So same thing for the inside, because your inside's basically like your skin, but on the inside. You have a hollow tube from your mouth to your anus. So anywhere, like your skin, you can grow a mole anywhere. On the inside of you, you can grow a polyp within your colon. And some of these polyps can be nothing polyps, kind of like a mole on your skin. Some of them could turn into a colon cancer. So that's why it's important to have these screenings and have every polyp taken off. So not every polyp turns into a cancer, but every cancer comes from a polyp.
Okay.
So besides a family history before 45, are there any other signs or symptoms that could possibly send you in to an early colonoscopy or endoscopy?
So colon cancer in general is kind of like a silent killer. You don't know it's a problem until it's too late.
Mhm.
But there are things that you can look for. There's abdominal pain. There's blood in your stool. And blood can mean a lot of different things. It could be something as little as hemorrhoids, which are enlarged blood vessels in your rectum.
Mhm.
And that would be blood like a drip in the toilet or on the outside of your stool. Blood mixed in with your stool, you're going to be more concerned. And
Is it a deeper red or a brighter red? Is there a difference between
if
the
it's
blood?
bright red, you can estimate that it's coming from right at the exit.
Okay.
Because as blood, say if you have a GI bleed in your stomach, you're digesting that blood, so it's breaking down. So it's going to look more like a baby. A baby's first poop. It's very dark and tarry.
Hmm.
That's what it would look like if it's a higher GI bleed,
Okay.
because it's been partially digested.
Okay.
Yeah, you hear the term sticky a lot too.
Mhm.
Sticky?
It's got a very distinct smell
Mm-hmm.
if you are passing a lot of blood.
Mm-hmm. You can definitely
You're
tell.
a nurse, you know
Yeah,
that
coming from the
smell
ER,
coming
like,
down a
having
hallway.
Yeah.
Yeah, GI bleeds are definitely have a distinct smell to them.
Yeah.
Hmm. I remember working the floor, and you could tell as soon as you walked in the door, oh my, there's somebody with a GI bleed tonight.
Mm-hmm.
Yeah.
Mm-hmm.
So you're looking for more, if you have a GI bleed or you have a bleed that's more concerning, it's going to be very distinctive. It's not going to be like, oh, I wiped and it's like, what is that? And then
Yeah.
the next time you're fine. It's
Yeah.
going to
If
be,
you-
it's going to be something that you're really like aware
Yeah.
of.
So if it would be more from like a colon cancer, you'd probably be more anemic. It would be a slow blood loss.
Okay.
So you'd be starting to get a little weak, maybe pale in color. I mean, but it takes time. It's
Yeah.
not like it's going to happen overnight that you're anemic.
So tell us what the steps of like a colonoscopy for like just going in for the first time, what to expect from that.
Okay, so you would definitely need a consult from your physician. So your regular physician says, "Hey, it's time. You're over the age of 45. Let's get you screened."
Okay.
Or you can ask for it. So you get your consultation. Sometimes, depending on the facility, you can either go directly to your physician and get your procedure, or you can get go to a GI physician, have your office visit, and then come to your colonoscopy.
Okay.
I've worked at facilities that you get a direct referral, and then you have to do your prep, your washout, make sure your colon's clean, because you can't see through mud. You've got to have a clean colon. Your colon prep, once you've done your prep, should look like this. It should look like watered down apple juice.
Mm.
So it should be very clean. And then you come in to the facility, get your health history. The nurses go over your health history, do a little physical, go over your medicines, ask you about your prep, make sure everything went fine. And then you go back to, you get an IV started, get your baseline vital signs, and then you go to a procedure room. Once you get into a procedure room, you're being continuously monitored. You've got your IV fluids, you've got oxygen, you've got your vital signs that are being taken every 5 minutes.
Someone only watching your airway.
What's that?
Someone only watching your airway.
Making sure that your airway's fine. For me, as a sedation nurse, I do have to have ACLS. I'm ACLS certified, BLS certified, so I can intervene if I give too much sedation. Every room we set up with things like airway management supplies, continuous monitoring, O2 suction available. So we're very safe.
What determines your level of sedation?
There's a lot of things that can determine it. So there's been a huge push for MAC anesthesia, which is monitored anesthesia care. So at that point, a nurse anesthetist does the sedation. I provide moderate sedation, which is Versed and fentanyl. It's a little bit lower, and it doesn't affect your breathing as much as propofol can. So if we take that step up, then you get anesthesia stepping in. I describe the difference between them as, so if you think of light switches, everybody knows light switches. So a light switch on and off is kind of like anesthesia. You get medicine, you go out quickly, you're out completely. You wake up quickly. So the light switch comes back on. You wear off your propofol really quickly. Moderate sedation's more like a dimmer switch. You get sleepier over a couple minutes. You're not out completely. You don't care what's going on. It's a little bit of I don't care, and I'm not going to feel very much.
like it.
And then you wake up slowly.
So here's my question for you. What is what determines that? So I'm going in full
Mhm.
disclosure. I'm going in July. I'm 3 years behind the ball here. So what determines? I go in. What gets me the light switch or the dimmer switch
Okay, so
like that?
when
You
I
want the
first
dimmer.
started in endoscopy, it was all moderate sedation,
Okay.
all done by a nurse, all first ed fentanyl. As time has passed, there's more psychotropics. There's more chemical dependency on narcotics and other drugs. So tolerance has become higher.
Yeah.
So people that have a lot of alcohol use a lot of drugs. If they're on a lot of psych meds, it's harder to sedate these patients. A lot of time. So my facility still does both. We still do some moderate sedation procedures and some propofol. Some facilities that I've worked at have done both. Some have done just straight MAC anesthesia. So it depends on the facility. So when we generally try to start with moderate sedation and see how people do. And then if they fail sedation, which means that we can't sedate them enough to get a procedure done safely, then we take the next step up. So we can abort the procedure and reschedule them. Or if we're in the middle of the procedure and we've given them a whole lot of medicine and we can tell that they weren't as comfortable as we would have liked them to be, then we automatically put in their notes, say, hey, MAC next time.
So
Hey guys.
like
Sorry to
I
interrupt.
actually had a colonoscopy, unlike all you unresponsible people. No, I'm just kidding. But I had a colonoscopy and an endoscopy at the same time.
Mhm.
And I think I had the propofol because they were coming from top
Okay.
to bottom. And
Correct.
I think I had the propofol because I came out like that and had
Mm.
no adverse side effects, no adverse coming out. I was talking on my way out of the room.
Was it
Mhm.
white? Was it like a white milky substance, Becky?
White milky.
I think
We call it milk
I
of
wasn't paying
amnesia.
attention.
Milk of amnesia.
Well, working in an ER, I know what propofol is, but is a reason why I could have gotten that is because I had it coming at both ends, or
Potentially, or the facility physician choice, or it could be that you're young and they probably anticipated that you were going to chew through medicine pretty quickly.
okay.
You
Hey,
like
but-
the party? I like it.
yeah.
Kim, have you
Party
ever? Destiny told me that she has one client that refuses any medications.
Yeah, we do have that.
Did you
Quite
have to talk?
frequently.
Did you
I
have to talk TJ out of that, or did you have to talk TJ out of that? Was he trying to go no medication?
Oh no! I said drug my ass. I was like, I don't want. See, my fear here's my
Literally
fear.
drug your ass.
I know. Look, here's my fear. I'm going to be in this, right? And whoever the physician is or the nurse is, I'm going to be like, they're going to put me out. Then I'm going to wake up halfway through with something in my butt. I'm going to freak out, and that's it. And I'm
That's not
going to
gonna
be traumatized.
happen.
So
That's not gonna
I'm
happen.
terrified of that, and I'm also terrified of recovery
No, the
Yeah.
recovery is nothing.
because I've never done a lot of surgeries. I don't.
Yeah.
I've never
I
really
haven't.
done. a lot
I've
of
had
treatment.
one in my life.
Yeah.
So besides this, and recovery was nothing. It was like I woke up, they gave me a juice, and I literally walked myself to the bathroom, changed, and left. It really isn't that bad.
TJ, you should be more worried about the stupid shit that's going to come out of your mouth while you're recovering.
I
That's
talked
my
about
fear.
dog.
You're most worried about.
I
Hey,
talked about my
it's
dog.
like Vegas. We don't tell any secrets.
So I
Yeah.
told her, I said, look, I've done some shady shit in my past life.
No, this is what
So
you
I
do.
don't need her to hear the
Truth
shit.
serum.
This
So I
is what you
said,
do.
she can't
So
get me until I'm fully
Yeah.
awake.
No, I went in talking about my dog because I connected with this nurse who had a corgi and another dog. And so we're talking about the dogs before I went in. Well, when I came out, we were still talking about the dog. So go in talking about something and you may
Right.
possibly coming out talking.
Yeah.
It's like you closed your eyes for 2 seconds and you woke up and you just kept going.
We
It
have
was
one
not
nurse
that.
anesthetist that tells all her patients, "I'm sending you to Hawaii. Bring me back a pineapple." Yep.
That's fantastic. I love that.
So it gets patients there. It gets their mind off of what's going on.
Yeah.
Yeah, I mean,
And
it can be
don't they-
terrifying.
Mhm.
So this procedure can be terrifying.
Mhm.
I mean, there's a lot of reasons that I'm scared for this procedure coming up that I'm doing because, because I'm late. I'm 3
Mhm.
years late.
That's okay.
Because I never really thought about it before. This wonderful woman said, "Hey, you got to take care of your health." No one really cared about my health, and I was like, "Hey, okay, no one cares about my health. I don't care either."
Yeah.
And now I'm taking care of it.
That's what matters.
Right.
Mhm.
Doing it now.
So
Well, it used to be that the screening age started at age 50. So if
Yeah.
that makes you feel any better.
that does. I'm 2 years away.
It was only within the last 5 years that it dropped down to age 45.
Yeah.
And to be honest with you, I'm not very far behind him. I'm only like 2 years behind him. So I'll be there
It's not bad,
too.
guys, I promise. It's not that bad. The worst part is the prep. Be prepared for your
Mhm.
preparation. Because that's
Well, I had a GI infection or whatever it was a
Mhm.
couple weeks ago, so I felt like I was practicing my prep.
yeah.
Yeah.
It was,
It's the
but
same
I was
thing,
vomiting
a little bit
too.
harder. Yeah.
So this one shouldn't be that hard with the
No.
prep.
Nope.
No.
It's just coming out of one end this time.
Yeah, that'd be nice.
Yep.
So we have a survival kit that Kim's going to show you guys real quick. So
I
go
had
ahead.
more stuff, but since we're on
Ooh.
vacation, I didn't bring it all with me. So invest in some good toilet paper.
Yeah.
And I got him some dude wipes. So and they're flushable. So so
That'll
So
help.
my hiney will
his
feel
hiney
good.
will be pampered.
Yeah. That will
And
help.
I
too,
got
your
her-
hiney.
I got him some petroleum jelly. So
Yeah.
have a
Is
little
that
bit
for
of barrier
practice?
because everything's running through your system so quickly. You got all that acid from your stomach. You don't
It
want to
hurts.
tear up
Yeah.
your bottom.
Can I just ask a quick question as you're showing us stuff? What about a bidet? Is that like something that you'd probably want
That
to
would
get
be
yourself hands-
fantastic.
It would be
Yeah.
so much
You got some
better.
We don't
bidet
have
before I
one.
do this.
Yet.
If you invested in one just for this, you would be loving yourself, and then you can continue using it forever.
Yeah.
That'd be
Sorry,
like
continue.
playing soft
It
music in
hurts
the
to
back.
wipe. It hurts to wipe after a while.
Yeah.
Yeah.
Look, be playing soft music in the back. I'd be like, woo.
Mhm.
And now there are things that you can do to make it a little bit more pleasurable because the day before you have
Pleasurable?
Pleasurable for him.
Yeah.
the whole day before you have to be on clear liquids, right?
Yeah.
So and it's hard to be on clear liquids, straight liquids all
Mhm.
day, but you can kind of cheat a little bit by making it feel like you're eating by having things like Jell-O, broth, any type of thicker liquids like Gatorade. You can do popsicles. As long as there's no fruit in the popsicles, you're golden. And as long as they're not red, brown, purple, because those can look like blood in the toilet. So
Yeah.
try and keep yourself full on liquids.
So I'm
Well,
only
this
asking
reminds me of a
you-
story.
Go
Kim.
ahead.
When it's probably like 10 or 15 years ago now, this mom was convinced that her kid had rectal bleeding, right?
I remember this. Oh my
And it was
God.
from the amount of fiery hot Cheetos this kid was eating. Open
Oh,
out the red dye of the fiery hot Cheetos. I was like, I need
Yep.
to see this blood. I just need to see this. And she opens up the diaper and I'm like, Jesus, man, this kid's in diapers and eating fiery hot Cheetos. Something's not adding up here.
Yeah.
oh my God.
Mountain Dew and
Yeah,
Fire
stop
Hot
feeding your kid
Cheetos.
fiery hot Cheetos and you won't get that. So that red dye makes things look like, makes very much
Oh.
makes things look like blood.
Nice. Yep.
Yeah.
I think I've heard beets.
Yeah.
Like
Or
pickled
beets.
beets.
Well, when I eat beets, I really get concerned. I'm like, oh, geez, what is going on? Do I need to call 911? Then I'm like, oh, I had beets last night.
Mhm.
You want to get really concerned, eat blueberry cereal.
Oh, yeah,
my
that's
God.
another one, dude.
That'll
Another
fuck
one.
with your
Blueberry
brain.
That turns
Yeah,
it
well.
blue or green.
Yeah.
Right.
Yeah.
That's concerning to
It
me.
is.
So here's another question, and I'm only asking this because someone's going to try this. During the day before you do your
Mhm.
clear liquids, and the day that you're doing the prep, is clear alcohol an option?
Alcohol is an option.
Sure.
I wouldn't
Would it
recommend
be
it.
dangerous?
I would not recommend it because you're going to feel even more dehydrated
Right.
and you're
I
probably
was
going to be a
gonna
little bit
say,
more
is it
hungover,
dangerous?
more of a headache.
Yeah.
Yeah. I just don't. I only
But it
ask that
is
because someone
cons-
can do that.
It is considered
clear
clear
liquid.
liquid.
Vodka.
Well, for me, I drink brown liquor, so I can't do it.
You
Doesn't
can't
matter
do
if you
it.
see light coming through it. You're all good, TJ.
Yes, sure.
Ooh.
Just drink vodka.
Yeah.
Yeah,
Drink
but
vodka.
chicken broths and jellos and things like that, like it sucks, but you still feel fuller because you're tasting a flavor.
Mhm.
It's all about actually having a flavor, even if
Yeah,
you
but-
can't chew it.
You
you're having
gotta
a flavor.
you gotta have a lot to drink, and maintaining that clear liquids is so important because the colon does not lie. If
Yeah.
you can tell us up and down that you didn't eat the day before, but if we put that scope in there and there's poop, the colon doesn't lie.
And it's not worth going through all of that
Mm-mm. Nope.
and
No.
having your colon so cloudy that you can't have the procedure done, and then you just have to do it again. It's
Mhm.
not worth
Yeah.
risking. You just stick to the protocol. You do what
Yep.
you're supposed to do. Don't waste your time, everybody's time. Do what you're
Yep.
supposed to do. Yeah.
Now, I do have to give a certain population the benefit of the doubt. So, diabetics,
Yeah.
their GI tract does generally run a little bit slower, so it's harder to get them clean. So, a lot of times we'll try and do a 2-day prep. So then you get 2
Oh.
days of clear liquids.
Oh no.
Yeah.
So are they just drinking like sucrose water, like to
What's
keep
that?
their? Are they? What are they doing to keep their sugars up?
Apple juice, the Gatorade, things, juices that have carbohydrates in them, or things, clear liquids that have carbohydrates. So then they're still getting the sugar, they're still getting the nutrition that they need, but they're not having food.
I know it's not a see-through liquid, but I know a lot of diabetics, their like go-to is orange juice. Is that a no-go?
If there's no pulp in it,
Okay.
if there's no pulp, then you're good.
Maybe you just water down your orange juice to make it even
Or
better?
strain it, get the no
Strain it.
pulp.
Okay.
Yep.
That's interesting.
It's
Okay.
technically it's considered a clear liquid as long as there's no pulp. Cranberry juice, apple juice, fruit punch. Even though the cranberry juice is red, it's still considered clear. Sodas, you can drink soda.
Hmm.
You can drink soda.
Okay.
So, what are some of the other things that you guys might find other than cancer?
So we can find diverticulosis, which is, it makes your colon kind of look like Swiss cheese. It's little out pouches. It's stretch pockets. If you remember back in the day, like way back, the tires that had the belts in them, and if one of the belts broke, it kind of made like a little bubble. That's essentially what diverticulosis looks like. It's the same lining as the rest of your colon. It's just a little outpouching. Now, all we recommend for that is a high fiber diet, getting plenty of fiber, getting plenty of fluid, just keeping your bowels regular so that you're not creating all that extra pressure that's going to make those pockets bigger. It used to be an old wives' tale to stay away from seeds and nuts.
Yeah.
Some people do have problems with those because they can get stuck in those little pockets. But if you're keeping your bowels regular and moving, it's generally not a problem. I do have a friend that had a huge issue with peanuts. Every time she'd eat peanuts, she would end up with diverticulitis, which is an infection in one of those little pockets.
Can I ask a question about that? Like, so a lot of stuff runs in our family, and my mom has diverticulitis. She has gotten 2 episodes within the last 7 years. Is that genetic or hereditary?
I don't think there's I'm not entirely sure if there's a genetic component to it, but there's definitely, our American diet just doesn't have enough fiber.
Right.
Kind of the golden rule for good colon health is at least 20 grams of fiber a day, 30 minutes of exercise a day, and 60 ounces of water, just so that you're keeping things moving.
Okay.
To put that 60 ounces of water in perspective,
Yes.
Kim and I are doing this challenge starting next Monday. We have to drink a gallon of water. That's just one of the requirements of this challenge. That's 128 ounces.
Okay.
Put
So
that in
even a
perspective.
half a
Just
So
Just 60 is all they're asking to do to have good colon
So
health
half a gallon.
for a half a gallon, or not, just below a half a gallon. And we're about to like pound a gallon a day. We did a test run.
It's hard. I was so
it was
sick.
miserable.
It's hard. You're in the bathroom. Frequently.
No, I was nauseous. Like I bought like a water bottle that has a gallon, and it's like drink this to this, this to this, this. It tells you what time. And I was like by 5 o'clock, I was so sick. Like my body wasn't used to that amount of water. So even if you can't do the whole thing, like take it slow because
So
and
it
it's
makes
really
you actually feel sick.
Yeah, it's really hard for me to get that amount of water in because I'm in and out of procedure rooms, and
you
can't have liquids in a procedure room. So it's going to be hard for me to find the time to get that gallon in. I'm going to have to drink a lot before I get there and a lot after.
Yeah.
Which is hard for me because I'm old, and if I'll be up all damn night.
Yeah.
Like an old man.
Yeah, no,
you got to get all that water in early.
It's annoying that you're going to the bathroom so much. After a while, you're like, it's not even worth it. I'm in the bathroom every 10 minutes.
Right.
Well, Becky, you got to also watch it when you start drinking water like that. You kind of got to change your diet, not change your diet a little bit, but especially you guys, you're going to be working out, sweating. You're going to be diluting your electrolytes on top of losing electrolytes. So that'll make you feel funky as hell too. You know, you start having the sodium, potassium levels start to get all out of whack, and then you're really.
So we'll definitely end up being diligent on getting our multivitamins in.
Get all the stuff in.
Lots of our foods. So what are some of the other things that you should be looking for? Other things that you can find on these screens.
So for inflammatory bowel patients, we're looking for Crohn's disease, ulcerative colitis, which is ulcers within the colon. Crohn's is an autoimmune disorder, and it can happen anywhere from the mouth to the anus. And there's ulcerations. You can get narrowings, and ulcerative colitis is more is just the large intestine. So we're looking for signs of that, and that would be more patients that have a lot of pain, passing a lot of blood, mucousy stools. They have a lot of dietary issues. It's more a younger population. So we're looking so depending on what the patients are coming in for, we might look at those things. But just for our routine screening patients, we're looking mostly for polyps and getting those treated if they're there.
So I have my nurses here, so I'm going to ask a general question. Say somebody's been complaining of left-sided abdominal pain for like 2 weeks and it's like constant. What do you guys have anything that you would be like, oh, that sounds like maybe this?
Definitely speak to your physician about it and get the appropriate screenings done. They'll look at maybe they'll do some radiology exams, stool testing, whether or not they're having any other symptoms. Look at, it's not a fine science, so you want to find all the pieces to the puzzle and figure out where exactly it's coming from. Because it could be a GI issue, your liver's there, there's other stuff right there. So you want to make sure you're looking at the right thing.
Okay.
So
Brian,
Bobby, do you have any questions for us? Because you came in.
No. No, I'm good. Talking about buttholes. I'm doing
like my butthole's clear.
Your butthole. Hey, Bobby and Brian,
Yes.
both of you need to be getting a scope because we have early family.
Yeah, I've got my
That's
Fitbit.
why I had mine.
Got my Fitbit going, but Destiny told me, because Destiny works in and does this all day, and she's like, the physicians there are like, if you have any concern, just go straight for the procedure. Don't those fit kits are so, like you said, Kim, they're like, you have to, because they're looking for blood, right? That's what they're really looking for is blood.
There's actually 3 different kinds. There's the FIT, which is the fecal immunochemical test, which you do every year, or the guaiac-based fecal occult blood test, which is looking for blood. And then there's this, which is a yearly. And then there's the stool DNA test, which you can do every 3 years.
Okay. Yeah, we do fits.
I remember we used to do the guayap.
Yeah, we do
there,
fits.
didn't we? Where we'd stick the finger up and then put it on the card.
Yeah, that was for more like people would come in and with a GI bleed
They
complaint.
had GI bleed.
Yeah, they would like just do a point of care like guayap.
Yeah, point of care.
Yeah.
Stick 'em.
Mhm.
Yeah.
Yeah, that's
So what? I
That's-
do have a question, actually. Now that I think about it.
Okay.
Ready?
Yeah.
So what? Obviously, there's a difference between what you're doing and the Cologuard. But
I
what is
think-
that looking for?
I think that's the stool DNA test.
Yeah.
Yeah.
It is.
Oh, it's a DNA test.
Yeah.
What's the
And
one
that
that
comes
checks
right-
for?
It comes right to your home. You can.
Yeah.
They've had the commercials for it.
Yeah.
Yeah, I've seen it.
Yeah.
It's a little
Little
box
box.
dancing.
Yeah.
I thought it was early screening for colon cancer. Is
It
that not
is.
right, or it is? Okay.
It is.
But with
So-
those, it's not an exact science, so you can get false
Okay.
negatives, false positives, depend because you're doing it yourself. So,
Error.
yeah,
Yeah.
it can be personal error,
Yeah.
not getting enough part of the stool, not getting the right part of the stool. So, direct visualization is really the gold standard.
Yeah.
Yeah.
Go in there and get it done.
You guys,
Yeah.
have you guys ever watched? Sorry, have you guys ever watched the "It's Always Sunny in Philadelphia" episode? Who pooped the bed?
No.
No, that's
What?
I'm sure. I'm
We had
sure
that
it was great.
scientist looking
Though.
at that poop under the microscope to determine who pooped the bed.
Now,
I'm sure it was
I will-
amazing.
It was
So for someone that just scheduled their screening, I think I did it like a month and a half ago, and so I went with a doctor's office she recommended, and I'm not getting it until July. That's how
Mhm.
far
Oh, yeah.
behind.
Sorry, how did
Because-
Kim determine which? Was it the cutest doctors? How did she determine which clinic she wanted to go to?
Actually, because I've worked in this in our home state area for a while, and a lot of the people that I work with have worked with outside facilities. I kind of talk to everybody. I'm like, so who do you get, and
Yeah.
who would you recommend? So I went down the list, and we had one that we were hoping for, but he's booked out clear until October.
Right,
So then he ended up with somebody
You
in
must have
that
a nice
same
gentle
group.
touch.
right.
Yeah.
Make the appointment now, boys.
Yeah,
Mhm.
and it's partly my fault because I could have easily gone to her hospital and had it done on her floor, but
I wouldn't have been able to participate, of
Right.
course.
Right.
But the problem that I had, and it's stupid, but we do Christmas parties with them every
Mhm.
year.
Mhm.
So I
They
don't
don't
want to be
care about
like
your
sitting at the
butthole.
table like, hey, how's your butthole?
They don't care.
Well, TJ, I'm the same way. You know, I'm
I-
going to the doctor tomorrow after last week, and I'm not going to any doctors at my clinics. I'm going to go all the way over the hill to San Jose to freaking
Right.
go to another doctor
Oh my
because you're
God,
right. There's
I-
just certain things that you don't want to discuss. Like, you know, you
Yeah.
don't want.
Mhm.
Of course, they can look at your medical record if they wanted to,
Mhm.
but they, you know, they're be getting into your medical record without necessity.
I
But-
had a doctor perform a gallbladderectomy, which is that's not what it's called, but they took my gallbladder out after I flirted with her husband at an office Christmas party. You guys,
Mhm.
let's
Ouch.
get shit
Oh,
taken
ouch.
care of.
What
Just
else did you take out, Becky?
relaxing.
You're probably
Yeah.
missing a couple other things too. You just don't know it
Yeah.
yet.
Probably, well, she did take out a hernia too, but like,
I'll take that ovary.
Just have to. It might have been, but just get it done. Like they don't give a
Mhm.
shit about
Yeah.
what your body looks
Yeah.
like.
Yeah, I don't. I mean, I'm not. I'm.
I
just-
literally look at at least 5 butts a day.
Yeah, nobody cares. If
We
it's-
don't pay
if it's-
attention.
If you trust these people,
Mhm.
just get it done.
Right.
They don't
You-
care. And
you
they're-
prefer
they're
that-
not gonna look at you. They're
do you
not gonna
prefer
be
that
like,
we
"Oh, I
shave?
know what his butthole
Do you
looks
prefer that
like."
we shave our butthole first, or do you,
No.
do you guys like to shave your butthole?
Not
shave your
totally
butthole.
and completely not necessary.
It's good. They're gonna do it dry, man. So
Mm,
My
Be
butthole
careful.
was so red and bloody and irritated from the prep. They
Yeah.
just didn't care. They're like, we still gonna probe it in there. It doesn't
Yeah,
matter.
We
look.
do use lubricant, and some facilities do have a little bit of lidocaine gel that they can use.
Oh.
We use it.
You know what? My
Sounds
nurse is not going to use
sore.
lidocaine jelly on me because for 17 years in the ER, I never used lidocaine jelly on any one of my catheter insertions. So
Oh, you're a
Come back to
dick.
haunt me,
Why
man.
would you do that?
because what the hell? That's a waste of your time. It's not even. You're going right in right after the lubricant, right after the numbing gel.
Yeah,
not doing
it's
anything.
not really enough time. So
We never even
So
had
for patients that are unsedated,
Yeah.
or like for flexible sigmoidoscopies, we don't give sedation for. Or if somebody chooses to have their colonoscopy without sedation, we do offer some lidocaine
Do they
gel,
cry?
and I usually try and sneak some in before while we're waiting, so
Do
it has
they
a few
cry?
minutes
The
to
people
take
that
effect.
do the people that don't have sedation cry or experience pain?
Well, your experience, it's not near what you would experience for like labor pains, but like we have one nurse that I work with who had her colonoscopy without sedation. One of the
Hell no.
physicians that I work with does his every time without sedation.
Nope.
So you
I've
think
done so many enemas without sedation when I have to
Nope.
stick
Yeah,
4
it's-
feet of tube up somebody's butt
Yeah.
without
you're very bloated, very gassy.
Yeah.
There's times when you're going to feel a little pressure. It can be done, but if you can get sedation, please.
I
You
would.
want to be comfortable.
Why not experience, like with my pregnancy and when I had my child, I said, I'm getting an epidural because I want to enjoy this experience and not be crying in pain throughout the experience. So same thing with your colonoscopy. Not saying that you enjoy the experience, but enjoy it enough that you won't mind doing it again.
Mm-hmm. We don't want you to be scared of us because
Yeah.
I try to make sure every patient is happy when they leave because I don't want patients to be scared of us. I want them to get their screenings. I want them to come back.
Yep.
So you've never seen like a doctor like spit on the tube and wink at the person right before they go in?
Ryan,
Oh my God.
No, never.
That'd probably be a little bit. Make it different.
yeah.
Probably
I
not.
would go back and get another one. That's my experience. It was good.
Well-
It was so good. I would do it again. Like, I'm not afraid to do it again.
The biggest one is just get the screening. I like I
Get it
said
done.
earlier, I really didn't, honestly, I didn't have anybody that really gave a damn if I got a screening or not. I mean, it's not something we talk about here. So I just kind of ignored it, so I'm glad I'm getting it now.
Yes.
Still terrified. I'm terrified of everything.
Don't be terrified.
Of our dad.
I wouldn't, TJ, I would never steer you wrong. Don't be terrified. And neither would Kim. Kim
Oh, I
does
know.
daily.
She's so excited about my prep. She's like, "Oh, you're going to be great."
He's gonna be
She's
just
gonna
fine.
take
I'm gonna make sure he has everything he needs. I'm gonna make
Exactly.
sure he's got magazines sitting right by the toilet.
I'm going to
I'm
watch
gonna make
TikTok.
sure he's golden.
If TikTok gets banned before this,
Oh, you're in
I'm gonna be
trouble
hot.
if it gets banned.
If they ban it, I'm gonna be so hot. Then I'm gonna have to
You're
watch
gonna
some
be
other
fine.
BS.
Don't be scared.
So, biggest thing is get your screenings. Do everything your doctors recommend.
Yeah.
And
Mm.
yeah, no, that was
He's dead.
hard
Yeah.
because I know I've gone to the doctor and they were like, "Hey, you need to do this." I'm like, "See you, dude." But,
Don't just
anyways,
blind listen to your doctor, but have a nurse friend.
Yeah.
Have a
Nurse
nurse
friends
friend
are
who can tell you
better.
what's
Yeah.
going on.
Yeah.
Now, one
Nurses
more
don't
thing.
work.
I usually we've had people on the show, and we don't tell them what agency, but I think it's important that we tell them what, not the hospital, the actual location of your hospital, but you do work for the VA, and we think that's really important because our service members, our veterans, need to be taken care of. So, we thank you
Yeah.
from being a military family. We thank you for working with the veterans because I know veterans can be kind of a pain in the butt. But
Yeah.
we know that I personally know that you love your patients and you always show them honor.
Special population.
Yeah, special population. So that's really cool. I know that the VA's had a lot of backlash over the last 20 years or so, but nurses like you and the nurses that I know that work with you are just amazing nurses and amazing doctors. So we thank you that you do what you do. And thank you for coming on the show tonight.
Yeah. Sorry I was so late.
It's all right.
That's
So
okay.
before we end the show, Bobby, how's driving school going for the buddy?
Oh, well, I mean, today was his first day. So
Okay.
he said he learned about like points on a license and insurance and things that aren't related to actually driving, which is
Okay.
kind of frustrating. But for the price
It's
of
day
it,
one.
I
That's
know, but
important to
let's go
know.
over signs. Let's go over. I don't
That's
know.
day 2
Maybe
and 3, 4, and 5, and 6.
Learn how to Tokyo
but
drift.
it's like a 4-hour class.
Right.
I mean, it's like
We're not
for 3
learning how to
straight weeks,
Tokyo drift.
Monday
Bobby, but you
through
had to have
Thursday.
what, 10 hours of drive time with him before he started?
Yeah,
Oh no, that's more.
So how'd that
Is
go?
it 10
for
hours?
us it was only 10. Yeah,
Okay.
yeah.
Well,
How'd that go?
I mean, no accidents, so
Did
it
you
wasn't
drive on
bad.
roads
Yeah,
or just parking
Yeah.
lots?
roads. You
no,
have to
he
be on
doesn't
roads.
have the Bobby gene.
What have I done?
Let's see.
Ran
He
into
went.
a fence?
No.
that-
He went down a ditch, up the ditch, and
that's
almost took a
right.
satellite out.
Yeah, that's right.
Mm.
That's right. But I mean, in my
He's only like
Let's
10
be
at the
fair, he
time,
was,
though.
He's only
So-
10, but
he was 8 years old. Give him a break.
I
Okay,
actually
what
did
was
get a ticket. I got a ticket the other day though, which I'm really pissed off about. Yeah. So I was driving right next to a police officer and it was 35 and I was going like 38. And I'm like, you know what? I can't go 38 anymore. I've got to keep going. So I go in front of him and I'm
Don't
getting ready
ever
to
do
turn left
that.
here shortly. And he gets behind me and he's kind of just hanging out and the lights come on. And I'm like, dude, I was going like 39 in a 35, you know?
You passed
I
him
pull
though.
over. No. Shannon forgot to get her registration for a year and a half.
oh,
How the hell did you guys not
up!
get pulled over before
The
that?
cop was like, I was going to let you go, but he was like, I can't let that go.
Oh my
And,
God, Shay
So
Shay.
we were getting the registration apparently for our old car, not our new car. So it wasn't, so
That's
I
not your
guess that's a
fault.
problem. Well,
Right.
it was our fault.
Was it a
We
Centerville
just-
beauty?
Yeah.
Oh,
He was
shit.
very kind about it. I'm like, come
Oh
on,
my
do I
God.
you
really
just
need
have
to
to get
take?
the registration, pay the court fines, and that's
No,
it.
we didn't have to do any of that. We just we ended up paying like $230 for the registration because we were so late
Right.
as a
Okay.
penalty, and
Yeah.
then $160 ticket, which
Oh my
hurt.
God.
But
Okay.
Mm.
Well,
But
I'm
I'm
proud.
usually pretty
I'm
good.
happy to report that I love my baby. You know, guys, I love Navi,
Mhm.
but Navi is officially off my insurance,
Oh.
and she has to
25?
pay her own property taxes on her car.
She's 26.
We finally did it. We finally signed the car over to her, and she started insurance. And her appointment was last week for her registration because I signed the car over to her. And she texted me. She goes, "Well, I have my own insurance, and I just got the car done at the DMV." She says, "Adulting sucks."
It does suck.
So
It's a proud moment, though.
it is.
It's a proud
So I
moment.
got her through college, and now she has to pay her own car insurance, and I'm saving a whole crap load of money.
Well, you
So-
write down how you did that because I'm going to have to do that here pretty soon this
That's
afternoon.
the most important message. So,
Yeah, saving a lot of money.
right. So, Bobby, good luck because you got
Yeah.
about 4 or 5 more years of paying insurance. And
Oh, he has 10 more years. 9.
well, I mean, if you're like me, I don't know. I'll take that back. I was double standard because I paid Navi's insurance, but when Austin was such a knucklehead as a teenager, I didn't give him a car. I didn't do any of that,
Yeah.
and he went and did it all on his own.
Oh, wow.
So he bought himself a brand new car, pays his own car insurance. So because he came out a little rough, he learned, and he's
Yeah,
better
too.
off for it.
Yeah.
Yeah, well, we're
So
gonna
proud
have
of him.
Brody pay his own car insurance. I mean, I
There you
think
go.
Yeah, Brody
I think-
already works. He's
yeah,
got a
Brody
job.
just got a new job, so he's I mean, yeah, he'll make good money. So
What's his
Yeah.
new job?
he's working at the rec center.
Oh, wow,
Nice.
that's awesome.
Yeah, he's doing like camps with the kids and
That's so
field trips
fun.
and
Nice.
yeah, he doesn't
Okay.
start till the summer, so until then he'll still work at the grocery store. But
Okay, that's so cool.
But now, one thing that we didn't get growing up is, how to like financing. And all of us probably paid a hefty price, and some of us still are. I certainly am, even
I am
me.
too.
But it's like at some point they've got to kind of learn that to finance or learn how to be responsible with money.
Yeah.
So yeah, we're gonna make him. He's gonna pay for his own gas. We'll buy him a car, but
Nice.
we'll probably have him pay for some of that.
Yeah.
And it's not
Yeah.
going to be anything fancy or nice. It'll be just a regular car,
Yeah.
But yeah, we'll figure it out. I'm excited though. I'm excited for
But
him.
it's
He's
also-
excited.
It's not even like, so Pat bought Connor a car for his birthday
Mm-hmm.
and he doesn't want to drive.
Ooh, I'll take it.
That's
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 right.
what I'm dealing with.
Mhm.
Yeah,
Um,
he doesn't want to drive. He has his permit, but he refuses to drive. And I'm like, you got a car for your birthday. Like,
Yeah.
Yeah.
I have an almost 17-year-old who does not want to learn how to drive because
Some people-
everything is within walking distance, and he's just doesn't have the desire. But then I have a 14-year-old who's like chomping
Ready?
at the bit, who
Yeah.
just can't wait to have the
yeah,
opportunity
I
to
don't know. I
drive.
don't know what to do to like. I don't
Is
know
he
what-
going? Is Connor going through driver's training yet?
No, he doesn't
No.
want to drive. He's driven
At all?
for like 10 minutes. He has his permit. He's had his
Yeah.
permit. He's driven about 10 minutes and he doesn't want to drive again.
There you go.
Yeah. Some
I
people
don't know
just
what
don't
to
like
do.
driving.
Well, folks, you learned a lot about making sure your colon works and get your damn kids and teach them how to drive right. So
Yeah,
Right.
our sidewalks are safe.
sidewalks
Yeah.
are safe.
And that's all we got for y'all tonight. I hope you enjoyed the show.
Yeah.
Really make sure you take care of your screenings and
Yeah.
you learn something from this and enjoy yourself for the week. We're in Tennessee for another 4 or 5 days.
So
Oh,
much
yeah.
fun. Oh my
fun.
God.
Thank you.
It's life.
I didn't meet Dolly today, but I will be
Nice.
the one day.
You
So-
will. No doubt. No doubt.
All right. We love you.
All right.
Thank
Love
you
you.
for
I love
attending.
Take care, guys.
Take care.
See you guys.
Keep it up.